I'm striking because as a psychiatric RN, I started my career with Kaiser 6 years ago as an LVN. Through KP's, constant, we strive to have you advance your career. I believed in the propaganda, and I went and got my RN degree and successfully transferred into a psychiatric RN role after having 8 years of LVN experience in psychiatry. And I did not know that that would involve me in, giving up benefits, essentially, especially my pension. And another thing I realized when I got here was there are no contractual obligations for Kaiser to repay our loans that we take out to advance our careers. There's the pay scale is different. We do not have NorCal counterparts. So in the NorCal contract for NUHW, there are no psychiatric RNs. We're in a class of our own, and there's 200 of us. But yet, some of us are coming into this union making less than a new grad, starting with UNAC on a med surg floor, and we're considered specialty nurses, which means we have specialized training in the field that we're helping in. And I fighting on behalf of my RN colleagues who also continue to dedicate their time and efforts, standing on the front lines, helping our COVID patients, and they went 5 years without a wage increase. So they were doing this for pennies on a dollar, being bombarded bombarded with patient care that they really didn't have to do and that their other colleagues were backing out of. So, yes, they deserve their wages. I'm doing this for my nurses who took that extra step and not only got their associates, but they also got a bachelor's in science and nursing. That stands for something. That's additional educational years on top of what they already did to get a degree that they're not being paid for. Nurses who are training other nurses, because as we all know, most of our psychiatry positions go externally. So these nurses are training people without additional compensation, and it's taking time away from patient care out of their day, and we're being overloaded as far as workload distribution. Especially in the region that I'm from, Riverside, especially, they're hiring new doctors, but yet they're not hiring enough staff to keep up with that. And it seems like every week there's an added responsibility to our already full plates. I mean, Kaiser doesn't understand that psychiatric RNs are the bridge to a patient's provider, to their psychiatrist, to their medication refills, to their off work orders. We get those calls, we assess, we make a determination, but we also have to deal with all of these outside factors. And, we work alongside therapists who are also overworked and do not have available resources. So, guess who in turn becomes therapists as well? It's falling on the psychiatric RNs, and Kaiser needs to take accountability for all of those things. So, this is the reason why I'm striking. NUHW psychiatric nurses only make up 200 of the 2,400 members. And even though we are a small minority, we still have a voice. We have a voice that's been screaming for years to be treated equally and equitably under the NUHW contract and by Kaiser. We want to put our name on the map, and there are a few brave nurses who are stepping in to make sure that we are all heard. So it's not just for me, it's not just for Riverside, it's for all of you nurses. And we're going to put our names out there and ourselves included with NUHW as we should have been from the get-go.